factor number 9, which is going to affect whether your implants can potentially fail in the first 4 months of all-on-4 treatment. That is, surgical experience, right? So we're just kind of talking about that, right? So the more, obviously, the more surgical experience, the less likelihood of potential failure, right?
Yeah.
Just because we know how to circumvent some of these issues, right?
Yeah. 'Cause I feel like I still learn from every case that I do.
Anybody that doesn't have a crazy ego will sit there and say,
Yeah.
you're always going to learn something.
Yeah.
So, I to this day still, and I think about halfway in my career, about like I've probably been doing like 7 years into taking wisdom teeth. You do thousands and thousands of them.
Yeah.
And you say, oh, it's going to be easy. And then you finally realize to keep your mouth shut. Yeah, that's just, nothing. You just don't want, it's like the kiss of death. Like, do not say it's going to be easy, So, same concept with all-on-4, right? I swear to God, there are cases where we say, it's like, oh, it's going to be a cakewalk. It's going to be easy. That actually happened to our oral surgeon the other day. We were looking at her x-rays real quick and we thought it was going to be a slam dunk case. I think it was like on Wednesday, and the patient's bone was insanely soft, right? So that patient actually had to wear a denture.
Yeah.
Yeah, because the patient's bone was like butter. What's kind of crazy that people don't know this is sometimes you could just push the drill through the bone without even powering the drill. It's that soft, right? So that actually happened to our oral surgeon the other day. So, but we will say that with one caveat though, is that again, surgical experience can help you navigate some of these issues, right?
Yes.
So even though you may have softer bone, there's with enough experience, engaging the piriform rim, how you go through your progression of using your drills and where you stop short with your last drill, all these little nuances that surgical experience can tell you how to get the best outcome, whether making sure that patient goes home with teeth that day or making sure that patient's not going to have implant failure. Would you agree with that?
Yeah. I mean, when I first started doing the procedure, I would say when I first started placing implants, I couldn't really distinguish between like hard bone and soft bone. Like all the bone just felt the same to me. But as I gained more experience in implant surgery, I was able to, I guess I kind of gained this tactile sense, over time.
What I will say too is, doing my first implant in 2009 in residency, and then and you could do tons of implants, and then doing all-on-4 is a totally different beast. So somebody that may say that they do dental implants, I don't care if you've done 5,000 implants. If you haven't done all-on-4, it's it's great that you know how to drill to place an implant, but to get an ideal outcome where you get enough torque and making sure you know how to position your multi-unit abutments for an ideal solution and all these things, that's all-on-4 is another art upon itself, right? Would you agree with that?
I think so.
Yeah.
Yeah.
So you can have all the single dental implant bridges, individual implants, experience in the world, but all-on-4 is a completely different beast.
Yeah, because it's not just a surgery that you have to think about. You have to also think about the prosthetic aspect.
Right.
What's the point of placing implants if we're not going to get an ideal prosthetic outcome?
Right.
We don't just, we're not just putting implants, where bone is. We got to make sure we put them where, we're going to get a good, a set of teeth.
The whole point of getting the set of teeth is to make sure it's beautiful, right? To make sure that they're very functional, that you can chew with them, that you can speak with them, right? So making sure you have a good prosthesis, that's great, but we can't do that if we don't position the implants in the right areas.
Yes.
So people will be like, well, why is this even in the conversation? Well, some people don't have the bone to be able to place that implant in the right area.
Yeah.
And so that's where the surgical expertise comes into play, where now I'm going to try to navigate to be able to place this implant in the right area where it needs to be for our prosthodontists to be able to finalize and make your teeth an ideal outcome, right? Because if that's not right, then nothing's right, right? So all that was for naught, right? If you like this clip, make sure you watch the full version of this video here at this link. Thanks.